For the last year, I have run a Facebook page that has shared and described COVID-19 data for the state of Indiana. No one asked me to do this. It's not an official page. It was actually born out of a personal need. It's grown well beyond what I thought it possibly could. I've learned a ton about sharing complex information with a wide audience and growing a supportive online community. But before you can understand anything about that, you have to know where it came from. You see, the spring of 2020, early spring of 2020, as an ICU physician was a very odd time. Before things changed here, we knew what was coming. And we had two feelings about it. On one hand, we were scared. As ICU physicians, we didn't know if we were going to have enough supplies, ventilators, and people to care for all the COVID-19 patients that could possibly come. On the other hand, it was sort of like you're standing on the starting line of a race. You're excited and nervous sort of at the same time. You've been training for this for a very long time. And so there was an anticipation as well. But this was not to be for me. I would not take care of COVID-19 patients as they came into our hospitals last spring. Because as COVID-19 was bearing down on us, my wife Sarah was diagnosed with breast cancer. You can imagine that this turned our world upside down. There was a moment standing in our bedroom after her diagnosis and as the coronavirus was coming, but before things were bad, when I had just gotten a phone call with some friends, and we were talking about the engineering behind using one ventilator for 2 patients, which is something that we've never done before. And she could tell I was excited. And she stopped me and she said, "Gabe, you know you're not going to be able to do this, right?" And I said, "What?" She said, "You're not going to be able to go into the intensive care unit while I'm getting chemotherapy." And she was right. Sure enough, a few days later, my boss grabbed me and said, "Hey, Gabe, I know what's going on with Sarah. We're going to have you do backstage stuff. You can help with logistics, education, scheduling, but we don't want you going into the intensive care unit." And I have to say that the feeling that I had from that discussion was one of immense gratitude. I was extremely thankful for the fact that these people were going to go into the fray for me, but at the same time, I had a lot of shame. I had a lot of shame and guilt about the fact that they were going to put themselves in harm's way for me. And that shame and guilt kind of mixed with my underlying just anxious personality, and it had nowhere to come out. So I had to figure out how was I going to deal with this? What was I going to do to get my head around what was going on? I'm a data person. I started going to the data. So I would go every day to the State Department of Health website and I would download the case numbers. And for me, looking at the case numbers, putting them into a spreadsheet, into a little box, allowed me to somehow control it. At least gave me the impression that I was controlling it. And I realized that the level of comfort that I got from this activity, just looking at the data and trying to process it in my head, was helpful enough that maybe this information would be helpful for others. So I started to look. I'm a medical educator. I help explain complex things to people who need to learn them all the time. And so I looked for places, where can I take these data and help to share them? Because at that time, there was still a lot of unease about whether or not this was even a thing yet. So I needed a place to go to say, hey, this is a thing. I'm very active on Twitter. I love Twitter. It's a wonderful marketplace of ideas. And so I went to Twitter. The problem with Twitter for me was that Twitter is an echo chamber of medical educators and ICU physicians who all were beating the same drum. There was no one there to teach because we were all trying to teach each other the same thing. I hadn't been a big Facebook person, I'll be honest. I had shuttered my Facebook account years ago. But I sort of opened it up, reactivated my account, and started looking around and realized, whoa, this is a place where people could use information. I took that spreadsheet full of data, and I started putting it into graphs and sharing it once a day on my Facebook page. People started sharing it a lot, to the point where people started asking me, requesting friendship on Facebook that I didn't know and that knew no one that I knew. And I knew at that point that I had to find a place for this. So I gave it a name, and the Hoosier COVID-19 update was born. It's a simple page. And I put it together thinking maybe 100 people would follow it, and then I'd be able to educate a few people about what was going on, and maybe they would share with others. I was very wrong. Because after 2 days, 1,000 people were following it, and after a month, 10,000 were following it, and now over 41,000 people follow the Hoosier COVID-19 update page. It's humbling. So what is the page? It's quite simple. The page is a little bit of data, followed by information about where you can get a vaccine, followed by a little commentary about the data. And I always finish with a sentence or two about the upcoming weather. I have no idea why I share this weather information. I've done it since the beginning, but I know that when I don't, people let me know that I need to share the weather next time, so I do. And when you share something like this on social media for so many people, it gets a lot of activity. So the average post gets about 200 comments. And the mantra for social media as a general rule is, don't read the comments. But I can tell you that the Hoosier COVID-19 update community is one that is unbelievably supportive and optimistic. I've never seen anything like it online. People go there for simple things like asking questions. Hey, can my kid get the vaccine? Yes, your 17-year-old can get a vaccine, and here it is. And these answers that you see on the screen are not answers that I provided, they're answers that other people from the page have provided. They go there to share vaccine victories. The last month or so has basically been a litany of people exclamating that they've gotten the vaccine, which has been awesome. And they go and they say thank you. They say thank you to me for putting the page together, which is amazingly supportive and bolstering. Putting this page together has been unbelievably humbling, overwhelming at times, but mostly humbling. And I've learned multiple things. First, I've learned that you can't share just data. This is a graph that I share every day of the cases in the state of Indiana over the past year. And there have been several days where I haven't had time to put together a commentary, so I'll just share the graphs and a little bit of data. And nobody engages with those. People don't come for the data, they come for the meaning behind the data. And there are three ways, I think, if I deconstruct things as much as I can, that I've tried to give meaning to the data. The first is by sharing stories. Without stories, data is meaningless. So last year, as the summer was coming, and we were all learning how to deal with quarantine for the first time, we're all pretty used to it now, but at that point, we had no idea what the summer was going to look like. People were asking questions like, can I go on vacation? Can my kids play soccer? What do I do with my parents? So my wife and I sat down, Sarah and I sat down and had a conversation about what this all meant. And I put together a post about this conversation. Sharing stories means I have to share a little bit about myself, but it gives meaning to those graphs and the data and the cases in the state that I think keeps people engaged. The second thing is humor. I talk about mosh pits all the time on the page. I've never been in a mosh pit, I'm going to be completely honest. But mosh pits are shorthand for COVID risky stuff. The people who read the COVID-19 update know when I talk about mosh pits, I'm talking about those things where we're close to people and breathing heavily and likely to spread virus. And it's this little amount of humor, I think, that keep people coming back. Lastly, I use a lot of analogies because there's a lot of complex stuff going on that we don't understand and that we're trying to just get our heads around. And explaining this complex scientific stuff for an audience that may not have a scientific background requires that I put it in language that they can kind of relate to. So in describing the B.1.1.7 variant, which is thought to be more infectious than the usual variant of SARS-CoV-2, I likened it to a bull rider. It's just a better bull rider if the bull is the nasal cells in my nose. It's able to hold on better and cause infection more. People understand what bull riders are and what rodeos are. And so analogies have been an important way for me to describe complex scientific information to a wide audience so that they can understand it. I've also learned and been explicit about avoiding politics. This whole thing has kind of been a political mess, and people just want a place to go where they can get facts and data and stories around those facts and data. So I, early on, made an explicit decision to only share non-political things as much as possible. And people have commented almost daily about the fact that this is why they keep coming back. The problem is, if I start to infuse my politics, I lose half the audience. And the half the audience that I'm probably going to lose is the half that needs the information more than anything else. So I've been very explicit about trying to avoid discussions that get overly political. Lastly, the comments section can get heated, I'll be honest. And I have been explicit about allowing for civil dissent and civil disagreement within the comments section. I don't police it that much. There's no way I can. There's 200 comments almost every day. I don't have that kind of time. But one of the examples of this is teachers. Early on, the state of Indiana prioritized age for vaccines, and I fully agreed with this. I thought this was the right way to go. But boy, teachers were upset. I haven't had this many teachers mad at me since 6th grade. And comments like this, where they were advocating for themselves, were important to be there. This was an important conversation to have. So allowing for and encouraging civil dissent was important. There are even people who have commented against vaccines, and that gets to stay as well. As long as they're civil, it can be there. You can see here that 13 people replied to this one, and I can guarantee you they were all pro-vaccine. Now, there have been times when people have been uncivil, and I had to learn early on how to deal with this. And the way that I deal with this is I click that little message button below that message that's uncivil. And that gets me a private space to talk to that person and say, hey, we're trying to create a place of positivity where people can disagree but do it in a civil manner. And I've been floored by the responses to this. Almost always those people stay. 2 people have had to be banned over the course of the year when I've been curating this page. Lastly, I've had to learn to be humble. Humble in my language, because I've been wrong a lot, as a lot of us have been, in regards to how this thing has gone. So I look for opportunities to admit when I'm wrong. Similarly, I look for opportunities to say I don't know, and I say it a lot. Because even today, over a year into this pandemic, there are still a lot of things we don't know. And in public health, admitting those things that you don't know is super important. So humble language has been an important feature of the page that I think has also helped keep people engaged. I've learned a lot about sharing complex information with a wide audience and about cultivating and curating a supportive online community. A lot of people have commented that this page has helped get them through a difficult time. And if I'm honest, this page has helped me far more than it's helped them get through probably the most difficult year of my life. I'm extremely thankful that my wife, Sarah, is healthy, finished with her treatments, and cancer-free. I'm thankful for the community that the Hoosier COVID-19 update has become and the connections that I made there. And I'll be most thankful for the day when I don't have to do it anymore. Thank you.